Breaking news, a confirmed case of Ebola here in New York City. The patient, a doctor who worked in West Africa and arrived home 1 week ago. Good evening, I'm Christine Johnson.
And I'm Maurice Dubois. This is what we know right now. 33-year-old Dr. Craig Spencer is being treated at Bellevue Hospital.
His fiance, who is not showing symptoms, is also in isolation at the hospital as a precaution. An Ebola response team is working to identify anyone who may have had recent contact with Spencer in recent days.
We have live team coverage of the diagnosis tonight. We begin with CBS 2's Lou Young outside of Bellevue Hospital on the east side. Lou.
Well, they expected it, and now it's here. An Ebola patient is being treated at the isolation ward here at Bellevue Hospital, one of 8 hospitals designated to receive these patients. Now, tonight here at the hospital, the mayor, the governor, federal, state, and city health officials all agreed that this first case went according to plan. New York's first Ebola case is a 33-year-old doctor who was brought into isolation early Thursday afternoon. The procession taking Dr. Craig Spencer to Bellevue included 2 city ambulances and a police escort.
The EMS system brought him in with the proper protective gear. He was immediately brought to the isolation area that Bellevue Hospital has established for patients who could have Ebola. He has been taken care of by an excellent team.
For the relevant period of time, he was only exposed to a very few people, partially because he knew exactly what the illness was all about, and he was taking precautions on his own.
Last Friday, Spencer returned to New York from West Africa, where he was treating Ebola patients. He was in the country of Guinea. He came through JFK Airport and passed the extensive screening process because he did not have any symptoms. However, by Thursday morning, he was running a fever and experiencing gastrointestinal distress.
He came in very early in his illness.
Dr. Spencer had been taking his temperature twice a day, according to protocols for someone who's been in the Ebola hot zone. We're told he started feeling fatigued on Tuesday. On Wednesday, he still managed a 3-mile jog before taking the subway to meet friends in Brooklyn.
From a public health point of view, I feel confident that we're doing everything that we should be doing, and we have the situation under control.
Regarding the subway, I would get on the subway tomorrow and ride the subway.
An incident like this was expected. The protocol has been in the works since July. EMS crews seen in these photos met Dr. Spencer at his building in full protective gear. They then placed him in a similar suit and loaded him into the ambulance. One team from the Centers for Disease Control is already at Bellevue Hospital. Another is on the way to retrace all the patient's movements. But the message is the public is not at risk.
People should rest assured that the extraordinary medical professionals of this city and this state are working to ensure that every protection is in place.
In addition to Dr. Spencer, there are 4 people in isolation. His fiance, who is here at Bellevue, 2 friends, and a driver who drove him last night. They're being isolated separately. None of them are sick. State Health Commissioner Dr. Howard Zucker said that he believes Dr. Spencer can make what he called a quick recovery from his illness. The real danger now is not to the general public or anybody who met Dr. Spencer while he was walking around New York, but to the healthcare workers who are treating him. And the CEO here at Bellevue says none of those healthcare workers have balked at their duty so far. We're live at Bellevue Hospital. Lou Young, CBS 2 News.
All right, Lou, thank you.